the first in the country. Immediate past governor, our leader, Senator Dr. Okowa, a man who, when he was at the Senate, was one of the major arrowheads for the National Health Act. Way back in 2017, in his first tenure, had this commission set up with different plans, the equity plan, the formal plan, private plans, and all of that. Because ill health most of the time may not give you an invitation card that is coming. So that if you pay a premium, you can access health without digging a big hole in your finances or your pocket. Then of course the vulnerables. When our Lord Jesus Christ said, when the woman with the alabaster jar of oil anointed his feet, he said, the poor will always be with you. We know Jesus as loving and compassionate. The poor will always be there. Poor, quote and unquote. The vulnerables. Pregnant women, under 5, above 65, our brothers living with disabilities, and all of that. Today, across the government hospitals and indeed private hospitals, our people are accessing health. We are believing that it could get better. There are challenges. I mean, what with the skyrocketing cost of drugs occasioned by pulling out of some big multinationals and the dollar soaring to the high heavens. But this is the way to go. Health insurance is a major source of health financing, and Delta is in the forefront. In the years to come, this governor, right, Honorable Elder Sheriff, has in more than one way shown his deep commitment in ensuring that this commission not only survives, but even does better. More enrollees will come on stream. Enrollee satisfaction is key, because it's one thing for the people to access health, it's another thing for them to live satisfied. That is being looked into. How? By improving on infrastructure and manpower. Then of course, the awareness. How many Deltans know about this scheme? Very soon, the DG, the statutory board members, the directors, indeed, everybody in this commission will go out on advocacy, on road shows, reaching out to people in our local language, in the riverine areas, hard to reach rural areas, letting them know that this scheme exists. Already they know. You'll be surprised. We are in some very hard to reach areas like Oproza, Polopubo, Akubene, Ogbingbiri, Obudubudu, Waterside, Ode Shekiri. These are riverine areas that the last time I visited, we spent hours on the Atlantic and its tributaries to get to them. But what about the land areas, those the non-riverine areas? We have hard to reach areas, Aliopu, Molo, Uchi, and the rest of them. We need to reach these people. They are all Deltans, and they have a right to good health. Our governor has made a commitment, and it is incumbent on us as his appointees to ensure that that commitment comes to fruition. The various will I say, stakeholders are involved. The public sector, the traditional institution, the organized private sector, they're all involved. Indeed, we have different plans. For example, we have what we call the Indigene Adoption Scheme, where the well-to-do in society, you reach out to the less fortunate. There are some innovative ways of reaching out, for example, to Okada riders, transporters, market women, students, and all of that. In our scheme, we talk about demand, we are the demand side. We create the demand. Our hospitals, they are the supply side. But we intend to be having quarterly meetings of these stakeholders where we rub minds. It's more like a peer review thing. We find out in what ways can we improve on the scheme. I have a small acronym which I mentioned when I came in here. They say KISS, keep it short and simple. I say MISS, make it short and simple. Cut out the highfalutin thing which the market woman at Ogbogonogo or Igbudu market or Geye market will not understand. Make it simple. 7,000 naira. You can pay it in little tranches. That's the innovative thing. But more importantly, it gives you access to walk in. We are working to make our IT system a lot more robust, whereby with your card, which has an IT, a chip, once you place it on any of our portals in most of our hospitals in the next few months, you were seen at Okwe, but here you are at Burutu. All your story will be gotten at Burutu. So you don't need to log your case notes and make phone calls and find out whether there's whether the network is working or is not working. But truth be said, make this health insurance scheme as simple as possible so that our people, not be able to go chop. Some of when we are going on our advocacy and roadshow, our local languages will be used so that our people will understand. Drama sketches will be made so that they can understand. We will use influential people in society to speak to our people so that nobody should be left outside the net. Before the end of the 4 years, God willing, one of the mandates of this commission is to register. We'll register indigenes of Delta State so that we'll know who we are catering for, and plan accordingly.